Hi, welcome back to my channel. In this video, I'll be talking about levels of significance. So this is a relatively very easier topic to understand. Like you will forget it also very soon. So you just need to go back through the table again and again. So yeah. So first of all, in level of significance, you need to know the difference between tangible and intangible. Now, tangible is something in English literature is something which you can hold. So in this one, what you mean is which can be perceived by patient, and intangible is which cannot be perceived by patient, but the dentist knows that the benefit of the therapy that he's doing. It is like the dentist is aware of the benefit, but the patient is not aware, or because the patient cannot perceive it, right? So you just need to know one table and it will solve all the questions, and most probably, like, yeah. So this is the table that I've been talking about. So, like, yeah. So this is sorry. So this is large and this is small. So this is basically the size of benefit. Then nature of benefit. So in nature of benefit, you can have, just write it with different color. Just give me a second. So this is large, and so this is nature of benefit. So either it can be tangible or it can be intangible. Okay, when it is just know the places where I'm writing. So when it is tangible and large, it is called as level 1. When it is tangible and small, it's called as level 2. When it is intangible but large, it's called as level 3. And when it is intangible as well as small, it's called as level 4. Now what do you mean by all this? See, we have different examples for every single category. So you have level 1, sorry. So you have level 1, then you have level 2, then you have level 3, and then you have level 4. Now just close your eyes, so for a matter of the fact you can just see the table on the screen also, and just try to recall what it was. So if you remember, we had this table and we just understand it without seeing the table, right? You had this table and it's better if I draw only this one. So level 1 was here. So you had tangible and you had large. So tangible and large benefit. Okay, then remember level 2 was somewhere here. So it was tangible and small. Then level 3 was here, intangible and large. And then 4th was here, which was like the worst of all, the least of all. So intangible and small benefit. Okay, so hopefully we have written it correctly. Yeah, so now we'll just go through the examples. So suppose there's a person who is like come with swollen gums. So there's a person who's come with swollen gums, and I, being a dentist, have given him vitamin C for scurvy. So there is going to be a visible change which is going to be evident to the patient, and it's obviously a large benefit. Now if there are high caries, and I give the patient, I tell the patient to change his lifestyle and eating habits. So I tell him to have a low carbohydrate diet. So as you know, that obviously the caries will decrease. So this is also like perceived by the patient. So this is like perceived by patient, and it is a large benefit. Okay, this one also, this. And the third example is if a patient is there of leukemia and we cure him through a bone marrow transplant. So this is like the mega example of level 1. Alright, now let's talk about second level. Now in second level, it is like the patient knows but the benefit was very small. So if you see, usually when a patient has a viral fever, he gets cured after like 7 days, 3 to 7 days usually. but like he comes to the doctor and the doctor also knows, but he prescribes him acyclovir because obviously he's come to the doctor, so obviously he is not going to go like, oh, it will resolve in 3 to 7 days. So the patient knew that my fever has resolved, but he didn't know that whether it was just because of the normal period of the disease or whether it was because of the drug. So that's why. But the patient knows that the fever is gone. So you have tangible and you have small. Alright, now let's talk about level 3. Oh, just wait. So let's talk about level 3. So in this, you have intangible but large. See, the patient is not able to perceive. So patient is not able to perceive the benefit, but it is a large benefit. Now, suppose there's a patient and perio department. So we have done root planing. Now I am like, so I've done root planing, but the patient is like, oh, okay. So suppose he had 5 mm pocket before, and because I did root planing, it converted into a 3 mm pocket. So there's a reduction of 2 mm pocket. So for a periodontist, it's a huge thing. But for a patient, what is 2 mm and what is 3 mm, what is 5 mm? Like he cannot perceive the pocket depth, right? And obviously, then there's one more example which is classically asked as a question is when there is a small decrease in cholesterol with low cholesterol. I'll just write it all, cholesterol lowering drugs. Okay, so yeah, so this is also a prime example. So you understood, like obviously this is a large benefit if we see from clinician perspective, but the patient does not know कि क्या what 2 mm of pocket is reduced, so what, like that. So this, then level 4 is like patient cannot even patient cannot perceive the benefit, and the benefit is relatively very small, so cannot perceive benefit and the benefit is relatively small. So suppose now there's a patient and like there's a small kid, and that kid has come to me and I do pit and fissure sealants on the child. Now in the child, obviously it will lead to a decrease in dental caries. Now how much it will decreases less only relatively, and the patient would be like, oh, he just applied something, but he does not know that we are preventing caries, right? Then if we prescribe him chlorhexidine varnish for caries, then antiretroviral therapy. So this is like highly active antiretroviral therapy. Alright, so just remember the table, right? So you have tangible, intangible, large, small, 1, 2, 3, 4. Alright, so this completes the thing that you need to know about levels of significance. If you found this video helpful, do give it a share. You can subscribe, you can comment. Thanks for watching.